Hey everyone, in this video, I'm going to show you how to relieve knee arthritis pain in 5 minutes or less using a percussion massage gun. Now these massage guns have become quite popular and they're much more affordable these days. You can get one for under $100 or around $100. This one's my favorite one. I've got a link for it in the description below. It's an affiliate link, so we make a tiny bit of money if you buy one through that link. So we appreciate it. You can support our channel and allow us to continue making these videos. But truly, I love this gun. It's the quietest gun that I've seen. It's pretty light. There are lighter ones out there, but I like the weight of this one because it helps with what you got to do. The attachments are easy to take on and take off. In fact, we've done a review on this. You can go check that out. I'll talk more about it there. My name's Dr. David Midoff, and I'm a specialist physical therapist at El Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please consider subscribing to our channel so that you don't miss out on any of the helpful videos we post each and every week. Now, before we get into using this device here, I just want to warn you to stay off your bones. You don't want to go on this device with your kneecap, or you want it to go onto your hip bone up here. We're going to be moving the tissues in the front of your thigh and hip here, but it's only for muscle. You don't want to be putting this on anything else but muscle. And you know, right here on the front of your thigh is all we're focused on. So you're going to flip your device on. This one has a switch here on the bottom that you flip over, and then the lights turn on. You hit that power button right there, and it's on the lowest setting, which is where we're going to start. So the first thing I need you to do is think about dividing the front of your thigh into thirds. You have your inner third, the front third right here, and the outer third. And you're just going to go up and down each one for about a minute or so. A little less is fine. And we're going to stick to the middle first because there's a muscle right there that tends to be the stiffest muscle when it comes to knee arthritis problems. And you're just going to go up and down to kind of warm up the tissue. And if you feel like you can tolerate a higher intensity right away, go for it. That's cool. I'm going to bump myself up a few notches here. And you're just going to do a couple of passes up and down and make sure to stay just on the muscle. Now, it doesn't matter if you have clothes on like myself or if you've got shorts on and you're directly on your skin, that's fine too. Whatever's most comfortable for you. And I'm pushing down slightly here. I can push down harder if I like. If you can tolerate it, that's fine. Just don't push on anything that hurts. You do want to find knots or tender spots, but don't push on them super hard. Like I've got maybe a little tiny knot right here. All you want to do is let the weight of the gun hang on there and your hand pressure just slightly increase, enough to not make it cringe or whine or cry or complain, but where it just kind of works it out. That's gold right there. If you can find a knot and just hang out on it for a bit, that is going to be super beneficial for helping out your knee arthritis. So once you've gone up and down the middle third here, the front of your thigh, then go onto the inside part of your thigh and go up and down. And typically on the inside part of your thigh right here, there's a teardrop shape of the quad muscle called the VMO. They call it the VMO. It's not really its own muscle. It's called the vastus medialis oblique. It's just certain fibers of the muscle that make like a teardrop shape right here. That's where people tend to get a little overdeveloped like myself, and you can work that out with a gun like this. Once you've gone up and down the inside part of the thigh here, then you want to go onto the outer part of the thigh, and this outer part has some hip flexor muscles in it that run all the way up into the front pocket area right here. This front pocket area is another spot like down here that can get kind of tender and stiff. You might get knots in there. For me, I get a little bit here, so I'm going to just dig in a little bit. In fact, I'm going to ramp up the intensity a bit. Went from up to 10. And the point here is just to relax and let it do its work. You can rub it around. You can hang out on the same spot. Just don't be on bone. Make sure you're on the muscle and get that area to soften up. And you can make some passes up and down just like so. A little bit of pressure is fine. You really don't need a ton of time doing this. You get diminishing returns after a few minutes, meaning it won't benefit you that much more. You need to actually go move and do exercise. That's what's going to benefit you more in the long run. So after you've gone up and down like this a few times, then what you can do to make this a little more intense is bend your knee. So it looks like this. You can put your leg up on the surface that you're on. You can put your leg up on something like this and work it this way, just so that you can see better. I'm going to put my knee down on this stool here, and I've got my knee bent a comfortable amount. If you can't bend your knee very good because of arthritis, then you'll have to find the best position to bend your knee in. All right, so here's a better angle for you to see what I'm doing here on the front of my thigh. So I bent my knee here. That puts a little bit of tension on the muscle. Just make sure it doesn't hurt your knee to bend it in this position. And now you're gonna do the exact same thing. Go up and down the front middle of the thigh, as many passes as you like. I typically will do 3 or 4, sometimes a bit more, but I feel like I have a knot. And then right here on the front, teardrop shaped muscle, hang out there a bit and give it some good pressure. Maybe up and down the inner groin, inner thigh muscle, adductor muscles is what they're called. And on the outside here, I'll hang out there a bit too. I do get a little stiffer on the outside here, especially up in this hip area. Now, these muscles are critical in influencing knee arthritis. The reason why you want to loosen them up is because with knee arthritis, you will develop an overpressure in the knee joint because these muscles are too overdeveloped and too overused. When that happens, it compresses the knee joint. It pushes the kneecap down against the thigh bone. Let me show you on the skeleton here. All those muscles on the front of the thigh, when they shorten up, they pull the kneecap up against the thigh bone. The hip flexor muscles, the one that's up here at your pocket, it has the ability to compress the knee joint along with the quad muscles. They can also push the shin bone into the thigh bone, and it compresses all the cartilage here in this area, which over time causes that cartilage to wear down and the joint to become more and more arthritic. So the reason why you would want to use one of these guns to soften up this muscle is because it can shorten a bit and stiffen, and if you can relax it and allow it to lengthen a bit, then temporarily you'll have some relief in your knee by decompressing it so that the arthritis isn't so bad. I think one of these goes a long way. If you don't have one already, you should highly consider getting one yourself. They are available in so many places now. Like I said earlier, they're so much more affordable now. They used to cost over $300 starting up to $500 or $600, and now you can get one for about $100 US or less if you can catch one on sale. The benefit to this is if you can get some temporary relief, that might replace taking pain medications, whether it's over-the-counter pain medications or prescription pain medications, and not just the cost of these medications, but the side effects of the medications, because they can damage your liver, your brain, your kidneys, and your other organs. You want to preserve those as much as possible, and this is a very natural solution for freeing up those muscles, and it's specific too, because pain medication doesn't specifically treat one thing in your body. Once you take it, it treats kind of the whole thing. Now, it can also help you avoid knee injections for pain, which of course is a more specific problem, but it's not treating the root problem, which is freeing up this muscle like this does. Now, the downside is it doesn't give you long-term relief, because after you loosen this up, you'll feel better. Like I already feel better right now. But these muscles are going to stiffen up again if you're not addressing the underlying root problem, which is a muscle imbalance. And typically these muscles back in here are too weak, and because of that weakness, these muscles are being used too much, causing that compression here. So fixing the root problem would have to do with fixing other muscles first to normalize pressures in the joint. Now, that might have been a lot, but I can promise you we go into so much more detail about it in other videos on this channel. In fact, we've linked them in the description below. If you go find the playlist for knee arthritis help, there's tons of videos in there to help you with exercises, advice, and tips for addressing your knee arthritis problem at home. Guys, if you like this video, give us a thumbs up, and please consider subscribing to our channel so that you don't miss out on any of our helpful videos. And we hope to see you in the next video, friends. Bye-bye.